Okay, today's December 5th, 2013, and we're here with Crane, who I videoed a year ago, right?
Yes.
About a year ago. And the video then was about your neck, correct?
Right.
And we did prolozone on your neck, and you really did quite well. And
Yes,
today you came in because you were having some pain in your sacroiliac joints, right?
Correct.
And I didn't make a video of you before I did your treatment because your range of motion wasn't really compromised like it might be with your neck. But before we get to your SI joint, how has your neck held up in the intervening time?
I think it's not only held up better, but better than it was before I came in. And so I'm ascribing most of that to the prolozone, but I also exercise it and keep it stretched out. And put Edgar Casey's favorite recipe for castor oil into it occasionally.
Putting castor oil packs on it?
Yeah.
Okay. Today you came in because you were having some pain in your hip on the right side.
Yeah.
Want to tell us about it, what it was like before you saw me and now, just shortly after we did your treatment?
Well, I came in feeling that I'd had a chronic situation with a nerve that seemed to be either pinched or inflamed chronically in my lower back near the hip. And that's been going on for years, and I've had a chronic pain in that area. But in 2 minutes after the treatment, it's I can't feel it. It's remarkable stuff.
Sort of like what happened with your neck.
Yeah.
Okay. So you're one who's had long-term improvement with neck problems.
Yes.
You came in with pain in the SI area, low back, and that cleared up instantly, 100%.
Remarkable.
So I'm really delighted about that. And now a word, because we know that you have Parkinson's disease.
Diagnosed 9 years ago.
Diagnosed 9 years ago. I want the viewer to see this man who's got Parkinson's disease for 9 years, who's not on any Parkinson's medication, who has held his own. You want to get up out of that chair and walk to the door, please? And come on back.
I'll be 82 in a few months.
Here's a man who's going to be 82 years old. He's got Parkinson's disease. And you just saw him get up and walk to the door. And I think he got up and walked to the door as well as you might expect a perfect 82-year-old man to do. Because by the time you're 82, many, or I would say the average 82-year-old, could be quite infirm.
Yeah.
And in your particular case, you're quite spry and mobile.
Yes, I do a lot.
And you're able to do everything you want to do.
Absolutely.
Good. For the viewer, keep a clean life. You eat a good diet, right?
I do.
You follow our recommendations.
I do. Mostly organic, a lot of raw, no meats, no dairy, no junk food, no gluten, etc.
Good. And would you say, I haven't seen you in about a year.
Right.
So you're on someone else's watch for a certain therapy. Would you say your Parkinson's has stayed the same, gotten better, or slipped in a year?
I think in the year there's some Parkinson's symptoms of the 22 that are ascribed as Parkinsonian problems that have continued to go forward a little bit. Others have stayed stable, others have reversed. So
okay, some have reversed, some have moved forward, but overall you would say you're stable.
I'm stable. Yeah.
I like that. When it comes to Parkinson's disease, that's a win.
I believe so.
Okay, if you catch it early,
yeah,
and you can stop the progression.
Yeah.
You've also had ozone therapy with us.
Yes.
And this was ozone therapy, but specifically for your joints today.
Right.
Okay, thanks. May I post this on YouTube?
Please do.
Thank you.